My name's Lana. I'm working with Dr. Mary LeBay at the University of Toronto in the Department of Nutritional Sciences. And I'm going to be presenting some work today that I've been doing as part of my postdoc, looking at Canadian food environment policies and international food environment policies as part of some more global monitoring efforts for food policy. I like to put my disclosure slide up. So this is funded by the Canadian Institutes of Health Research, and I've also received funding from Health Canada and FAC, as well as the Heart and Stroke Foundation. I don't have any conflict of interest to declare. I did recently present for the Canadian Federation of Agriculture, but I didn't receive any travel funding or honoraria. They didn't want to pay me for it. So we're talking a lot about food environments today, and I wanted to just define a little bit for you, when I talk about food environments, what that means to me. So this is a definition that was developed by Boyd Swinburne out of Auckland, and really it talks about the different parts of food environments, so physical, economic, political, and sociocultural pieces that come together to influence our food choices. And there's three really main players. We talk about the food industry, government, and society, and how they have different areas where they interact to influence the food environment. And today I'm going to be focusing on government policies in this talk. This work is part of some larger international efforts that are ongoing as part of Informis. That's the International Network for Food and Obesity or Non-Communicable Disease Research, Monitoring, and Action Support. Informis is also led by Boyd Swinburne out of University of Auckland. But really what he did is bring together a very large group of researchers from across the globe, and researchers as well as other policy stakeholders, including World Health Organization and others, to get together and establish some global methods for monitoring and benchmarking food environment policies, so that what we can do is have a better understanding of the global picture of what's going on and do some cross-country comparisons, which is a really valuable tool in research, especially when we can think about national food policies. It's very hard to evaluate a policy when it's implemented across an entire country because we don't have any controls. And so this allows us to do some comparisons between controls. So this is a very busy slide. This is the Informis sort of framework. As you can see, the top part in blue is really about some of the organizational processes. And so this is the policies both by the government and the public sector that influence the food environment. The green part in the middle, this is the main part, and what this is the all of the measures of the food environment. So they've established these modules, these 7 modules. They're each led by different researchers. And the modules have sets of methods that can be used to then evaluate the food environment in a particular country. And the last piece in orange is the outcome piece. And this is less of a focus of Informis, but it is important. And it really is looking at, okay, if we know what those policies are, how the policies translate into the environment, how does that then translate into dietary behaviors? So today I'm going to be focusing on the public sector policies and actions, and this tool is called Food EPI. That's the Healthy Food Environment Policy Index. And really it's an index, it's a tool and a process to look at how much progress is a country's government having or making towards best practice in improving food environments and implementing obesity and NCD prevention policies. So what this tool does is looks at a country's policies and it compares it to a set of international best practice. So Informis has gone through and they've identified a very large number of best practices in all of these different food environment areas. And then we can compare what Canada's doing to some of these other countries so that we have fair comparisons, and we're saying the government of Canada isn't yet doing this, but the government of Slovenia or the UK or Australia is, and then gives us sort of a measure for where we might move towards. Now this is a part of a larger project, so we're funded by the Canadian Institutes of Health Research for the Canadian part, but this is going on in almost 20 countries across the world right now, and you can see we really have a mix of high income, medium income, and low income countries, so it's really sort of a global effort. And what we want to know is, where does Canada fall compared to these best or promising global practices? And Food Epi specifically looks at the federal and provincial policies. And that's a bit of a unique piece to Canada, and one that made it infinitely more complicated for me, because in New Zealand, where they developed and first piloted this tool, they have one government structure. So when they had to go out and find all of the government policies, they had one body to go to. Well, we had to work with all the different ministries and agencies within the federal government, as well as within all of our provincial and territorial governments. So, suffice it to say, we have a lot of policy information. So if that's something that would be helpful to you, I'm very happy to share that data. We have basically all of the food environment policies across 42 different indicators at all the provinces, territories, and federally. So come and chat with me after. I'm happy to send you those documents. And these are the policy domains that we're going to be looking at. So Food Epi considers composition, so what's the formulation of foods, food labeling, promotion or marketing, the provision of foods in different settings, food retail practices, food pricing or taxation, and then issues around trade and investment. Now, today I wanted to pull out some of the relevant pieces that are specifically relevant to children. Obviously, all food environment policies affect children, and I had a hard time saying, well, this one, does food pricing really relate to children? Because it does. We know that it affects what parents buy for children. But these ones seemed a little bit more child-focused, and in the interest of time, I thought I would limit that a little bit. So as part of Food Epi, I said we identify all of these policies. Then we bring together experts from across the country to do those comparisons to the international best practice. And I think in the room here, we have about 10 or maybe 12 experts who were part of this process. So we engaged 80 experts from across Canada. And these are just some of their areas of expertise when we did a little word cloud. So you can see we had really diverse interests. We had people in food law, in all of the different domains. We also had policymakers who were there. They weren't involved in rating in the workshops, but they were involved in the transparency of the process to make sure that we were doing things that were sort of in line, the discussions were accurate, etc. So we did the federal ratings in person, and we did the provincial and territorial ratings online. And so we randomized people to complete one province or territory, and then they rated all of the policies provincially and territorially. So as you can see, we do have a fairly good number in each of our provinces and territories, so we're really quite happy. This is a lot of work, and so we are very, very grateful to our experts because it's quite a lot of hours that they've invested into this process. So, what did we find? So, today what I'm going to share with you is first some international examples of best practices. So, what have we identified as some of the most promising practices that are happening globally? And if those have been evaluated, I'll talk a little bit about the evidence. Now, one of the challenges that we know with work like this is evaluation is tough because we have these national policies. And the other piece that we know is that just that the evidence really varies in quality. And we also know that these things are happening right now. So a lot of these policies I'm going to be talking about, they happened last year or so. So the evaluations have yet to be completed. So keeping all that in mind, I'm going to chat a little bit. First is about food labeling, specifically front of package labeling, which is sort of an exciting area in Canada right now because we have some proposed policy coming up. So in terms of best practices, globally, we've seen that in Ecuador, they've implemented a traffic light system for sugar, fat, and salt. It's mandatory on the front of all packaged food items. Similarly, Chile has these warning labels for foods that are high in, and they have a criteria, nutrient profiling criteria for calories, saturated fat, sodium, and sugar. Australia and New Zealand have taken a different approach. So they have the Health Star rating. So that takes both positive and negative nutrients, and it puts it into a rating between 0.5 and 5 stars. And in the UK, they also have a traffic light system that also has some numeric information, and that's a voluntary system, but it is very widely implemented. It was one of the first to be implemented. What do we know about how much this works? Well, in England, some of the research that they've done found that we find that foods that have red symbols are less likely to be chosen or identified as healthy, and foods with fewer green are less likely to be chosen as healthy, again, by shoppers. And foods that had better colors, so more greens and yellows, for saturated fat and salt, were also more likely to be chosen as healthy, significantly greater than for total fat. So there seems to be more of a focus on saturated fat and salt. And in New Zealand, they did an evaluation. Now, this wasn't actually a Healthy Stars evaluation. It was an evaluation using a similar phone app. They did find some positive results, so shoppers thought that the interpretive labels were easy to use and they were easy to understand. And people who used these interpretive labeling systems did have healthier food purchases. So some suggestion that there may be a positive trend when they see these. So what do we have here in Canada? Well, right now we don't have a front of package warning label system on any of our foods. We have voluntary systems that are implemented. Although as part of Canada's healthy eating strategy, we have launched a public consultation. It actually closed now, but it was on the warning label type system. So Health Canada has said that they're going to put warning labels for saturated fat, for total sugar, and for sodium, or they're proposing that they're going to put those on packaged foods. The thresholds would be 15% of the daily value for sugar, sodium, and saturated fat. And it would be a little bit higher if those were prepackaged meals or combination dishes. And for foods that have very small reference amounts, that threshold would be based on 50 grams. So, for example, with cereals or things like that, they use a slightly larger portion size so that it's more likely to give those warning labels. So when our experts, so this is really preliminary data from my expert evaluation, so I'm going to share it today. But what we considered, the experts in our group considered that Canada had implemented about 20 to 40% of the policy compared to those best practices. So that's just sort of gives us a general idea of how Canada's faring compared to those international best practices. And this one, of course, it wasn't rated at the provincial level because front of package labeling is only a federal jurisdiction on food products. Next, I'm going to talk about food promotion, so marketing to children, also a hot topic, also part of the healthy eating strategy. I'm going to talk about broadcast media, non-broadcast media, and then in children's settings. In terms of our international examples, we should be proud because we do have one of the benchmarks here. So Quebec is a benchmark for marketing to children legislation. So in Quebec, as we know, they prohibit commercial advertising, both food and non-food, to children less than 13 years of age through all types of media. And in Chile, they also restrict all advertising directed to children under the age of 14 for foods that are in their high-in categories. So it's the same categories they use for that front of package labeling. And so they also restrict advertising to children for those unhealthy foods. In terms of other international policies for broadcast media, Norway and Sweden do not allow advertising on television for food and non-food that's directed to children 12 years and under. Ireland prohibits a number of different broadcast media for foods that are high in fats, sugars, and salt, specifically during times of day when children are watching and on children's programming, and they don't allow the use of celebrities. And in South Korea, TV advertising to children under 18 years of age is prohibited for specific food categories during specific time periods. So that's between 5 and 7 p.m. or during children-specific programming. And lastly, the last area is in children's settings. So we can restrict the marketing where children usually gather and play. So in Spain, they have a law that in kindergartens and schools, they can't have any food advertising unless it's actually authorized. Uruguay also prohibits all forms of advertising and marketing foods when they don't meet certain nutrition criteria, similar to what we have here in Ontario. And Hungary similarly doesn't allow any advertising at children in their school settings. So what's the evidence for some of these? Well, in Norway and Sweden, we have seen that children who are exposed to, they're actually exposed to less advertising. So that's a good thing. It means it's working. In Quebec, there are some differences between French-speaking and English-speaking children. And that's believed to be because some of the cross-border, some of the policy is a bit easier to apply to the French-speaking channels only. And in South Korea, they found that when they compared 6 countries, that there was actually some benefits between the peak viewing times for children of seeing less advertising. How do we do in Canada? Well, we have right now the broadcast code for advertising to children and the Canadian Code for Advertising Standards. These are very weak laws. They basically say that you just have to represent a balanced diet. It has to be in line with Canada's food guide. You can't show a lot of food at once. We have recently had Senate Bill 228 by Senator Green-Rain, which is the Child Health Protection Act, which originally would prohibit any marketing to children of any food under 13 years of age, although there have been some amendments to that now. And we do have the healthy eating strategy, which is under consultation, and we're going to talk a little bit about that later. That does include marketing to children. So that's funny formatting, but our experts thought that that was about 20 to 40% of some of the benchmarks where we are in Canada right now. And when we look at the provinces, what we saw was that Quebec obviously does very well for the non-broadcast and broadcast media. No one else is really doing anything. And in children's settings, there are some school policies that do address a little bit about food marketing, but not a lot. And Mary, I think, might touch on that a little bit. I think this is a problem, and I don't mean to pick on Dory, because I really like the movie, but when I see this in schools of characters that advertise anything, when I see this in stores, I have a big problem with it. So, sorry Dory, but we got to do better. And I am a fan of Beauty and the Beast. I don't know how many of you saw this on your bananas, but I thought that was a big step forward. And again, some creative advertising on potatoes here. I'm just going to talk briefly about food provision and some of the international examples. We do know that internationally, even at the federal level, that countries are implementing policies restricting what foods can be sold. So there are a number of different nutrient profiles, but we have a number of countries who are implementing strong policies at the federal level. And there's certainly some evidence for that. In Canada, at the federal level, we had a working group who provided some guidelines, an FPT working group on the consistency of some of these food and beverage policies. But what we see is that we don't have consistency right now through at all the provincial level, through all the schools. And Mary and Suchitra are going to talk a little bit about that in a little bit, so I'm not going to touch much more. And just to highlight that we don't have a school feeding program and no national standards on federally funded feeding programs. So we're really performing poorly here. Provincial level, we sort of vary by province, and again, that's Mary and Suchitra are going to talk about this. The last I'm going to touch on, because I'm running out of time here, is just the provision in public settings. So this is another consideration when we talk about rec centers or other public settings. We see that in other countries, they do have, for example, nutrition standards in hospitals, or vending machines that are in publicly funded settings, or in foods that are served by city agencies. But we haven't seen a lot in Canada in this area. So we don't have any federal procurement policies. We don't have any policies about food service activities at food events on federal property, except in our correctional services, where they do require that there is healthy food served according to Canada's food guide. So again, this is an area where we performed very poorly. And across the provinces, there was some variation. There are some recommendations in some provinces for some of the school public sector settings, but they certainly are not consistent right now. So I was going to talk about retail, but I think Leia's going to talk about this. Suffice it to say that we do have some really good international examples of where zoning policies are being implemented. Typically, those are not implemented at the federal or provincial level, but more at the local level. And so we don't really have a lot going on in Canada, either provincially or federally, both for unhealthy retail, so that would be limiting the availability in and around schools of fast food outlets, or for promoting zoning policies promoting healthy foods. We don't really have a lot going on federally or provincially, but Leia's going to touch on that. There's a lot going on in food environment policy internationally, and although we have a lot going on, really the evidence and the evaluation right now is a major challenge, and particularly the impact on children, because we have some of these studies going on sort of at the population level, but zeroing in on children is something where we can continue to focus on. We have signs of progress, but there certainly is room for improvement, as I've shown here today. And finally, it's certainly not consistent because of the unique jurisdictional regulatory nature of our policies here in Canada. It's a challenge to have consistent policies in all the provinces, and so federal guidance is certainly going to, and leadership is going to help. Shifting food environments for children holds promise. There is evidence that these work, and we need to make the healthy choice, the easy choice, and the preferred choice by children. So there needs to be some socio-cultural shifts as well. We know that children are a prime policy target. Policymakers like to work with vulnerable populations, and they like to target and support children, so that's a really great target. And right now in Canada, we have great political leadership. We have a great Minister of Health. We have a Prime Minister who also supports this, and so it's really an opportunity to push this forward. And so the healthy eating strategy we're going to talk a bit more about, but it's one piece of the policy puzzle. But I think we really have an open policy window right now. So with that, I will wrap up. Thank you very much for your time.